It is a very warm welcome to Optimal Vision Recruitment UK Limited and SG Education Nigeria Limited. If this is your first time of coming to our channel, please kindly subscribe, like, and hit the notification button so that you get notification when we upload a new video. And thank you very much if you're a returning subscriber to this channel. We're very happy that you've come, and we are here to support you to get study admission to study abroad in different countries. And we are here to provide information about legal immigration, information about nursing recruitment, legal immigration, Dubai visa, and Schengen visa if you are in the UK as well. This is going to be a very quick video, and this video is addressed to nurses, registered nurses who are thinking of coming to work in the UK as carers. I will speak small pidgin here. At the verse, very, very much for Nigerian nurses or Ghanaian nurses or Kenyan nurses or any other nurse from Africa who is thinking of coming to the UK as a healthcare assistant or as a support worker or probably as a senior carer. Why I would not suggest that option, it is your decision anyways, but why I would not suggest that is that it's going to be very, very debilitating clinically. It's going to take away all your clinical skills because you're only going to be doing washing or personal care, changing pads, and probably doing physical observations and making beds and serving food, doing laundry in some cases, and probably if you're very fortunate, you might be in a place where you can do medication. But apart from that, you are restricted in what you can do because, of course, you are a healthcare assistant. You are not a nurse. So all the skills you learned in nursing school, the pharmacology, the wound management, everything you learned, you keep it at the side. That's going to make you lose those skills, those clinical skills. You remember what the adage says? Practice makes perfect. If you spend 1 year, 2 years, 3 years, 4 years, 5 years doing nothing other than those things I've mentioned that HCAs do, then of course you are going to lose those clinical skills. Your nursing education that you had for 3 years, you will lose it. And that's not good. You didn't go to school to train as a nurse and then become a HCA. That's not a good idea. But I can understand some people, they have tried academic IELTS and they probably have done OET as well, and they feel, well, this is a shortcut. I would dare say that that's not the very best option. I give you an illustration here. No person who is a doctor or who is a pharmacist and who has written the exams, or who is a physiotherapist, or who is an occupational therapist, who has written these exams, or who is a social worker, who has written academic IELTS, OET, and is unable to meet the band, now says, like a doctor, say, okay, let me now come and start working as a nurse. No doctor does that. No pharmacist says, okay, let me start working like a pharmacy technician. No physiotherapist goes beyond their job description. They do what? They put in the hard work, get the band, and come to work either as a nurse, either as a doctor, a pharmacist, or a physiotherapist or occupational therapist. So nurses should not have the mindset that, oh, let me use the shortcut, because the shortcut might not be something that will be beneficial to you. You should stop bringing yourself to the UK or thinking of coming to the UK as a HCA, because that's lowering yourself to be a standard that is much not what you trained for. That's, in some cases, could be likened to auxiliary nurses claiming that they are registered nurses. That would be quackery in many cases. But like I said, it is your decision. If you feel like that's the only option you want to take, Okay, that's fine. But please watch our previous videos on the agencies that are recruiting so that you do not fall into the hands of unscrupulous elements who are going to ask you to pay them a huge amount of money for them to invite you to come to do maybe a conference or a training in the UK, and then before you know it, the training that they invite you for, by the time your visa gets to the desk of the embassy, the training is expired, and that's automatic visa refusal. Make sure you do your due diligence. Make sure you work hard to get the exams you need. Get the best materials. They are the best materials for these exams. Get the best materials, prepare very well, and you get the exams results you need to come to work in the UK as a nurse. Or if you choose to, you can do OET. That's an exam that is more related to health. It's more expensive, but you might do that. That might be more easier for you than academic IELTS. But my strong encouragement is do not bring yourself to the UK as a HCA, because the benefits might be there, but the disadvantage is quite huge. The money you're going to be paid as well, it's not going to be up to the standard of how much you're going to be paid as a nurse. So, and you know, as a pre-registered nurse, you paid band 3 or band 4, depending on the trust. And once you write your exams, you become a band 5 nurse, and you're going to be paid 25,000 plus per annum, with extra 20 hours that you can work each week. As a HCA, the hours of work are very, very, very long. Some people will put you on 44 hours, some 39, and so on. You'll be so knackered, you won't even have the energy to prepare for the exams you need to write to become a registered nurse. So it looks like a shortcut, but it might be a shortcut to something that is not good. So my encouragement is get the right materials, get the best materials, textbooks, get the best online tutorial if you can get them, and prepare diligently for this exam, because it is what you need for your success, for your future success. Your future and the life of your progeny, the life of your family, generations unborn, depends on the right decisions you make now. You don't want to make the wrong decision. You don't want to become a HCA when you were trained to be a registered nurse. You don't want to be a cat when you're supposed to be a lion. A lion is king of the jungle. You don't want to live being a lion and become a cat. No. That's not a great option. But if you decide that's the option you want to go with, okay, that's up to you. Another option some nurses have taken, if they decide they want to really move, they have come to do nursing program, top-up nursing program. We've been advertising that as well. Some have come to do master's program. And with the new post-study that is available now, you can do the top-up program for 1 year and become a BSc nurse from being a diploma nurse or just an RN. And then you can have the 2 years and use that to prepare to change your visa to a work visa. Or you can come to do a master's and use the 2 years post-study to do what you need to do to be able to transition to becoming a UK registered nurse. The beautiful thing is, if you're coming as a master's in nursing or master's in public health or health management or MBA student, you can travel with your family, which you cannot do when you are coming with the BSc top-up program. You can only bring your family when you are finished and you've been able to sort yourself out by getting a work visa. So this is what we have for you today. Please, please, please think very carefully. Think about your future. Think about what you need to do. And my encouragement is be a lion. Don't be a cat. Take the steps you need to take so as to be able to get the bands you need. I know people who have written academic IELTS exams 7 times, 8 times. They got it on the 9th time. People have written 10 times. They got it on the 11th time. The money you're going to spend to get those exams, the money you're going to results, the money you're going to spend to do for tutorials, to get the right textbooks and right materials, it is money well spent. It's much, much better than going into a contract for HCA for 1 year, 3 years, 5 years, where you have no joy of doing what you were taught, the beauty of nursing, looking after people, and all of that. That's not what we encourage you to do. We have given you the information. It is now your option, your choice to decide what to do. Either to come to the UK as a HCA, support worker or senior carer, or to come to do a top-up nursing program and take it from there, or come to do a master's program in public health, in nursing, in healthcare management, healthcare leadership, or MBA, and come with your family, and your partner will be helping you to work full-time and, support you, your husband, your wife. You can come with your children as well, as long as you can afford all their visa fees and the flight fees. So that's what we got for you this day. Thank you very much. And if you have not subscribed and they watch you, subscribe. Help this ministry. Support this channel. Like this channel. Subscribe. And hit the notification button so that when next we upload a video, you will be the first to be notified. And keep safe. Protect yourself from COVID. Wear your mask. Keep a safe distance. Take your vaccine if available to you. And I will definitely catch you on the next video. Thank you.